Okay, good morning. We're going to go ahead and get started. I hope everyone had a great weekend. Had some nice weather yesterday. All right, our first speaker this morning is Dr. Kerri Thurmon, Associate Professor of Surgery in the Urology Division. Was based at Denver Health, but recently moved to Highlands Ranch as part of the Department of Surgery. She did her undergraduate training and medical school training at the University of Missouri, and then went on to the University of Iowa to do urology residency as well as training to get an MPH. She started her first faculty position at University of Kansas and really developed a practice there and became very interested in coaching. And you'll hear a lot about that this morning. She has really spent her career not only taking care of urology patients, but really delving into the various levels of medical education, including medical students, residents, and faculty, and focusing on coaching, education, and also wellness. And I think, as you all know, those three areas really blend together, and there's a lot of overlap between those three areas of study and practice. She has become a certified professional coach, and you'll hear about that, and you'll hear about some of the programs that she and we are developing in the Department of Surgery and throughout the School of Medicine. So thank you so much for giving this talk, and welcome. Thank you.
Hello, everyone. My name is Kerri Thurmon. I'm a urologist, and I get to talk about my favorite thing this morning other than prostates, which is really exciting. So I'm going to talk about life coaching and really hopefully get some blood flowing to the brain, thinking in new ways, and really taking control of your life. I'm going to talk about something a little personal, so excuse me if I get emotional. I always thought once I was done with residency, I had made it. And after my first 2 years as faculty, I was so unhappy and so burnt out, and I couldn't understand why. And then I had kind of a personal tragedy occur, and I really had to take a look at my life and my choices and realize that I did have a choice. And so that's where life coaching came in for me. And so I just want to give you all the tools that I was able to get to make my life better. And it's all in our own sphere of control. And so today I want us to create awareness around who we really are, how professional coaching can aid in the pursuit of what we really want, understand the difference between coaching and mentorship. And I'm going to give you 3 principles of coaching today that you can use starting right now. So you can use this today in the operating room, in your clinic, or on your spouse or partner at home. And they're going to see a whole new you. And then we'll talk about data that supports professional coaching. So I always like to start off with this statement. I believe I have the power to create the life I want. And I'm curious if this statement is true for you, because I'll tell you, there was a time that I felt I had no control over my destiny, and I was just going with this flow of life, and it was not making me very happy. So if this statement is not true for you, what is blocking you from the life that you really want? And I challenge you today to take time to develop the idea of what you want your life to be today. So we're going to talk about consciousness. This is your awareness of who you really are, as opposed to the you that you believe you are and that you were taught that you are. And this is a lot of coaching here, is raising our consciousness, really getting in to our cortex here of who we are. So it's why you think the way you do, and elevating that consciousness allows you to live a fuller life. And so here's a schematic of who you think you are. And this is very developed by who our parents told us we were, our teachers, our colleagues, and even strangers. And who we think we are leads us to what we do and how we do it. So if you're taught your whole life that you're an average student, you don't challenge yourself, and you do things averagely. When we are told who we are, we tend to reinforce that limited who. And so this is where coaching really comes in, is we're coaching around the who. And you get to decide who you are. And evaluating and learning is how we recalibrate our who. So what is coaching? It's literally a vehicle to get a valued member from where they are to where they want to be. It's like a stagecoach. It provokes the thought and creativity needed to maximize one's potential. We are not fixing people. We're just helping them be their best selves. And it's space to align our personal and professional goals. So the coaching process is emotionally connecting you with your inner purpose and passion to your outer goals and strategies to bring about sustainable results. And this is why we see good data on coaching, particularly in the executive world, which it's been around for decades, because it's about inner change. We're not focusing on the environment around us. We're really focusing on our who. And we're helping ourselves consciously connect with our core thoughts and emotions, or metacognition, thinking about our thinking, which we don't often do. That's a really hard skill that we have to practice. And we're recognizing that that true positive change starts within us. So what we're really trying to do is shift our energy from I have to, I should, to I want to, and finally I choose to. And I lived a lot of my life shoulding all over myself. And I don't know if some of you feel this way, but particularly in my first 2 years of practice, I have to, I should, I have to, I should. And we really want to get to the point where we choose, because we all have the power of choice. So positive psychology, this is a really hard leap for many of us, because I was in such this negative self-talk spiral when I got out of training that thinking positively was really, really difficult. But what we know is that negative thoughts cause negative outcomes. That is for sure. And if we can get to the positive, that's so much more powerful. But we listen to the negative 10 times more than the positive. So just think if you could rewire your brain to focus on the positive. Now, this is really hard. So I challenge us today to not even get to the positive, but getting to the neutral. If we can just cut out some of that negative and get to neutral. So now let's talk about the difference between mentorship and coaching. Many of us in this room have been mentors. Most of us in this room have been mentors. So mentoring is a role model who has been there, done that. And we're going to show our mentees the ropes. Oftentimes we're identified by our mentee. So we're not assigned. This is something that happens organically over time because we share interests. And so mentorship is really a lot of telling people what to do. Coaching is totally different. And this is how I got interested in it. I was assigned as a coach, and I realized I was a horrible coach. All I did was tell people what to do based on my own experience. That is not coaching. Coaching is helping the client move forward using their own expertise. A coachee is an expert in their own life. We ask questions to allow clients to uncover the answer that is hidden internally. And we help identify goals and visions for the future. We have no agenda. Our true expertise is in the coaching process. So it's almost more fun to coach someone where I absolutely have no idea what they do or what their problem is, because I can really hone my coaching skills to get curious. and not put myself in their experience. So the core coaching differences, we listen to understand, not to fix. And this is really hard for physicians, particularly surgeons, because we love to fix, but we're not fixing. We're pointing our curiosity outwards, and we're not judging. We engage our client or our coachee's expertise. They are an expert in their own life. They know what to do. They just need space and time to figure that out. And we really focus on strengths instead of eliminating weaknesses. So my whole residency, I just focused on my deficiencies and trying to make those better. But if I had just focused a little bit more on what I was good at, I may have developed more skills more quickly. So emphasizing strengths builds self-efficacy, and self-efficacy is our belief that we can do things. So we want to focus future achievements on the basis of past successes. And this is a big coaching question. When have you done something in the past that was really hard, but you succeeded? What about you made that a success? We want to build on people who they are at their strongest and what they do well. How can they use these to tap into their self-efficacy? This is a study of gold medal athletes, and they were trying to figure out how these gold medal athletes took stressors and then went into these facilitated responses instead of reactionary that were very positive, meaning they got a gold medal. And so you could see these 5 factors: focus, positive thinking, motivation, confidence, and perceived social support. But then right in the middle is this processing thoughts, experiences, and challenges. And this in the middle is coaching. This is where we bring all those pieces together to get these facilitated responses against the negative effect of stressors. This is a qualitative study of internal medicine residents at the University of Washington. 29% of the 126 residents reported burnout in residency. We have data that show this number is even higher today. And they looked at 2 types of burnout. One was the circumstantial burnout. And this is the environmental triggers that you live with in residency. All those things around you that burn you out. High caseloads, long hours, patient acuity and deaths, taxing patient interactions, EMR challenges, unclear workflow patterns. And taking time off, doing yoga, things like that can help these circumstantial burnout. But then there's this existential burnout, and this stems from losing your purpose. A loss of meaning in medicine. And man, I have been there. And not very far into my career was I there and not understanding my purpose. And so this is where coaching really can make a huge difference, is this internal struggle with what am I doing with my life? Why am I doing this? So Martin Seligman is kind of this pioneer of positive thinking and human flourishing. And he talks about PERMA. And so these are often questions that we'll talk about in coaching. And so what makes you feel good? I encourage you to think about this today. What are you into? What relationships mean the most to you? What gives you meaning? And what are you really proud of that you have accomplished? This is a great place to start to realize how amazing you are. If you don't know where you're going, any road will get you there. And this described probably my first 10 years in medicine, medical school and residency. I had no idea what I was doing. I just focused on residency and just kind of let my life unfold for me, but I didn't take control. Now I know exactly what I want and how I'm going to get there. And when you know these things about yourself, who you are, your values, and what you want, all that white noise kind of goes away and you can focus on a clear path and you can create the life you want. We want to let go of this arrival fallacy. And I was a huge, I fell into this trap. When I finally get into medical school, that's when I'll be happy. When I get the residency of my dreams, oh, then it's going to happen. I'm finally going to get there. When I'm done with residency and I'm a faculty, that's happiness. And then you get to be a faculty and you realize this is worse than residency. This is so hard. So the time to be happy is where you are now. And this is so difficult to wrap your mind around when you're training. But thinking it's always just on the other side is just going to leave you disappointed and always wanting more and never having what you really want. Okay, so now let's talk about some coaching skills. I really hope that these 3 principles today you can start using and really notice a difference in your patient interactions, your interactions with your trainees, how you're feeling in the operating room with the nurses, etc. And so the first is listening. And this seems really easy. We all think we're pretty good listeners. And I just want to say we're not. We hear a patient say one keyword and we're already making up our plan in our head of what that patient needs. And I need you to throw that out the window and really listen. So listening is based on the agenda of the listener. So this is the subjective. So the client, I had the toughest time getting myself up an hour earlier this morning to work out. And the coach says, you just have to do it. And I don't know how many times I went to people when I was training and I was like, I'm really having a hard time in clinic. And they just saying, clinic is just something you have to force yourself to do. And so that's this subjective listening. We're using our own experience. I have to just force myself. That's what you need to do too. Not very effective. Then this gets a little better. You had to struggle, but you did it. Congrats. So the listener is focused on the person speaking. There are no thoughts about how the listener personally would handle it. It's effective, but we're not getting to the heart of the matter. And I would say this is where in coaching training, I really got a lot better with my listening. And so finally, you see the coach say, it sounds like you really want to do this, but you are so exhausted that you find it to be very challenging and maybe even a little bit frustrating. Here, the coach listened for what was not being said. They listened for the sensory components and they intuitively connected to their client. They were paying attention to what was not being said. Very, very hard to do. But I challenge you today, when someone is talking to you, just notice when you're putting yourself in that person's experience. Just notice it and try and stop yourself. Don't change anything else. Just notice that what you're doing and try and just say, oh, look at me putting myself in their experience. Second coaching skill, acknowledging and validating. So powerful. So this is the power of reflection. We're reflecting back what we are hearing, and then we pause to listen. We're trying to capture the energy, motivations, and strengths of the person that's talking to us. We're being honest, direct, and non-judgmental. So I'm giving you 2 phrases. What I'm hearing you say is, I'm hearing, or it sounds like. Sorry, that was 3. If you today, someone's talking to you and you just say, it sounds like, and you could literally say back the same thing they said to you, that person will snatch onto you and be like, wow, they were such a good listener. Go home to your spouse tonight. When they're talking about something, I just want you to say back to them, it sounds like. Keep it simple, and you don't have to be right. It sounds like. Number 2 challenge for today. Now we'll talk about validating. We all have feelings, and many of us feel guilty for having them, or we think we shouldn't feel the ways we do. We want to let people know that they have the right to feel the way they do. We are validating feelings and emotions, not behavior. So the phrase we want to use, it's understandable emotion. It's understandable you feel frustrated, okay? So second thing, it's understandable. Use that phrase tonight with your partner. We do not want to validate behaviors. It is not understandable that you yelled at the nurse. It is understandable that you felt really overwhelmed when you were getting paged every 2 minutes. And we want, validating is not judging. Whether what someone is saying is right or wrong is not our job. They just have the right to feel that way. And we want to normalize the situation. So it's understandable that you feel insert emotion because based on your values, it's only natural you feel blank. It can be very upsetting when this happens. Never say, I know how you feel, because you don't. We don't understand how other people feel, even though we think we do, because we've been there. So we want to acknowledge what was said, validate the feeling, and normalize the situation. Okay, final coaching skill is empowering questions, and this is so hard. So we want to get away from asking yes or no questions. Do you, can you, should you? We want to get away from that. We want them to be open-ended, clarity-seeking, probing, challenging, thought-provoking, future-directed, and solution-oriented. This sounds great. This is really hard to do in the moment when you're coaching. We want to get away from why, and we want to ask what and how. So here are some powerful coaching questions. What does success look like to you? What does a good doctor mean? What does a good resident mean? What is working well? What strengths do you have? How can you use what is working well to move forward? How would that support your desired outcome? So someone comes with a goal or challenge, we listen, reflect, and we ask a how or what question. What would it look like if things were going well? And we begin to co-create a way forward toward a goal. And this is the coaching process. So here is an example of a coaching conversation. How am I finding you today? Give me a story of you at your best. What do you love the most about your work? What are your strengths? Imagine it's the end of your next rotation and it went really well. What happened that made it so good? This is visioning, such a powerful tool. I have a visioning statement from about 3 years ago, and it's like I had a time machine. It wasn't this magical thing that I created. By thinking about what I wanted, I then made it happen because I wrote it down. Between now and the end of the next rotation, what is one thing you can work on to get towards your goals? So what about bad outcomes? And let's be honest, in medicine, this happens, and this is so upsetting. We don't want to rush to reassure. Our assurance lasts as long as the FaceTime with the person. We want to reflect and listen. We want to help them name an emotion, and then we consider asking these questions. What can this experience help you learn about yourself? What about someone who doesn't want coaching? We want to meet them where they're at. They are the boss. They get to decide what they want out of our time together. Is there anything they want to work on specifically? What is the narrative they want to build for themselves? And we need to be very comfortable with silence. And this is so hard because silence is so uncomfortable. But I will literally stare at someone for 2 to 3 minutes while they're coming up. And that silence, you're giving someone such a gift by holding space for them and allowing them time to think about what they really want. Okay, so I challenge you today to reflect daily on who you really are and what you really want. Practice your listening to understand, not to fix. Become more comfortable with silence. validate and acknowledge feelings and normalize situations, shift questions from why to what and how, and connect yourself and others with your personal strengths. Now I want to talk about some data. A group I'm involved in called Better Together was such a gift when I came to Colorado, and Dr. Christian is also a part of this group. So two internal medicine faculty were certified professional coaches and came up with this group coaching program to reduce burnout in female residents. And we did a pilot here at the University of Colorado with female residents, and we did a 6-month web-based physician group coaching program. Here's our team. And we had 300 female residents that looked into the program, and 101 volunteered. And so the goal was to get about 20, and we had a huge interest. And then they were randomized to the intervention group, which was the coaching program, and 50 to the control, which was just wellness at the ACGME level. And then those groups crossed over after the 6 months. And so Better Together consisted of online group coaching. So 2 nights a week, we held coaching calls from 7 to 8 at night that anyone in the program could jump on. And we had a theme of the week, but we also just group coached people in front of others and videoed those. And the engagement was huge. So not only did people jump online and listen to other people getting coached, but we could see them listening to the videos later. There were writing, coaching, workbooks, and YouTube webinars. And so here are the demographics. Most of our residents were PGY2s, white, 80 were non-surgical, and 20% were surgical. And we found at baseline that 50% of participants experienced moderate to high levels of burnout. And after the coaching, professional coaching significantly improved emotional exhaustion, self-compassion, and imposter syndrome. The other aspects of the MBI were also towards significance. And so when we looked at this qualitatively, the 3 things that stuck out were this metacognition as a healthy tool for coping, which is thinking about your thinking, the sense of community, meaning other people are feeling the same things I am, and that just brings this common humanity to the experience of residency, and this customizable experience. So this pilot was then taken to 26 GME programs. We had over 1,000 women, mean age of 30.8, and they were again randomized to intervention versus control. This time we shrunk the program down to 4 months and then crossed over. And then we saw statistically significant better outcomes in all 3 indexes of the MBI after the 4-month coaching program. So we had this unanticipated high demand for coaching. This longitudinal coaching format was really flexible and customizable. Group coaching cultivated a psychological safety that really allowed for vulnerability. And this asynchronous online model allowed people to have their customized experience, which they really enjoyed. Thank you.
We have time for a comment or a question. Anyone? Please, Matt.
Thank you so much. We had a wonderful team that organized that, and I was so happy to be a part of the coaching process.
Super. Please, Dr. Kovacs.
Wondering, you had a great need for this, but so many people backed out in the end. I'm wondering if there's a way to recapture those individuals and figure out why they didn't continue with the program.
Absolutely. I think that is such a good question. And you'll see that the people that came to the program volunteered, right? So we obviously had a bias.
So I just want to thank you and thank thank you in advance for being available for questions and emails from the audience, obviously. But every time you listen to a talk like this, you're not going to become an expert, right? You're not going to absorb everything, but pick up one or two pearls from the talk and try them out, right? What do you have to lose? And my guess is if you do that and you do this over the next 10, 20 years, you will get to where you want to be. So thank you so much for doing this.